In this film, the application of the thumb spica splint is demonstrated. In this case, the patient is presenting with a stable, non-displaced fracture of the first metacarpal bone. Rupture of the ulnar collateral ligament of the thumb may also be an indication for a thumb spica splint. Before applying the splint, the following adjacent joints and bones should be examined for injury: the interphalangeal joint, the anatomical snuff box, the wrist joint, and the elbow joint. The digits are examined to assess capillary refill and sensation. All these examinations are used to detect abnormalities so they can be acted on if necessary. Also, the findings can be compared to the physical examination after the splint has been applied. The following materials are needed to apply a thumb spica splint: one small stockinette with a width of 2.5 centimeters. Note that one side is cut obliquely. A stockinette with a width of 5 centimeters. Padding with a width of 7.5 centimeters. Plaster. For an average-size adult, 8 to 10 layers of plaster should be sufficient. An elastic wrap with a width of 7.5 centimeters. Medical tape. And bandage scissors. Do note that the size of the materials used depends on the size of the patient. First, the small stockinette is applied around the thumb. Note that the oblique side is located proximally. The length of the stockinette which will be applied around the forearm is measured. The stockinette should cover the entire forearm and should be long enough to cover all digits. A hole should be cut in the stockinette at the base of the thumb. The stockinette is applied over the forearm, at which the thumb is placed through the hole. Note that the stockinette is wrinkle-free, as wrinkling may cause irritation of the skin. Also note that the entire forearm and digits are included in the stockinette. Next, the padding needs to be applied. Care should be taken to apply extra padding over the ulnar prominence to avoid pressure complications. Too much padding should be avoided, as this may cause the splint to be too loose and be able to move over the arm, which may lead to scratches or blisters. Care should also be taken that the metacarpophalangeal joints of the 2nd to 5th ray are able to move freely after the splint has been applied. It is advised to take this into account during the application of the padding. The padding is applied so that the flat part is in contact with the limb, allowing easy unrolling. The application is started over the wrist, making sure to include the ulnar prominence. Then through the first web space, over the ulnar side of the hand, around the thumb, again over the ulnar side of the hand, through the first web space, and then the roll is further unrolled proximally. Note that each turn of padding overlaps the previous one by 50%. After applying the padding, the stockinette is still exposed distally and proximally. This way it can be folded back, as shown here, to protect the skin from sharp edges after the splint is applied. It is advised to check that there are no uncovered areas left. This should be avoided to limit the risk of thermal injury of the skin. For a thumb spica splint, a bottle-shaped piece of plaster can be used. How the plaster will be applied while dry is demonstrated. The plaster should be applied 2 finger breadths from the elbow crease along the radial side of the arm and wrist joint. The narrow piece will support the thumb while taking care that the nail of the thumb is exposed after the application, as demonstrated here. Water at room temperature is used, as too hot water causes the plaster to harden too quickly. The plaster is folded in a corrugated fashion. Care should be taken not to hold the plaster in the water for too long. The plaster is squeezed to get rid of excess water. It is applied to the arm and smoothened so any wrinkles are removed and the water is distributed evenly throughout the plaster. Care should be taken to not place the plaster over the skin, as this may irritate the skin and even cause thermal injuries. The remaining stockinette and padding are folded back to create smooth edges. An elastic wrap is used to fixate the splint. Again, note that the wrap is applied so that the flat part is in contact with the limb, allowing easy unrolling. After the wrist is encircled twice, the wrap is cut from the proximal side, leaving 2 to 3 centimeters intact. The uncut part is placed in the first web space, and the thumb is completely encircled as shown here. In this way, wrinkling of the elastic wrap is avoided, and the thumb is supported sufficiently. After the wrist is encircled again, the wrap is again passed through the first web space, but now without encircling the thumb. Note that some traction is placed onto the elastic wrap. Too much tension should be avoided, as this may compromise blood flow to the digits. The wrap is cut for the last time, and the thumb is encircled. The rest of the roll is unrolled further proximally until the entire forearm is covered, making sure each turn overlaps the previous one by at least 50%. The plaster is molded with the wrist joints slightly extended and in ulnar deviation. Care should be taken to avoid molding the plaster using fingertips, as pressure points may arise. One hand is placed in the first web space, with the thumb on the dorsal side, and the rest of the fingers on the volar side. This way the fracture is supported because it is located between the fingers of the orthopedic cast technician. The other hand is placed more proximally. This creates a 1, 2, 3-point fixation, which is needed to adequately support the fracture. The plaster is supported in this position until it is hard enough. Note that the interphalangeal joint of the thumb is not immobilized, and that the patient is able to flex and extend the metacarpophalangeal joint of the 2nd to 5th digits. Also note that the distance from the splint to the elbow crease is about 2 finger breadths. This is needed to adequately flex the elbow joint when placing the arm in a triangular bandage. Note that the thumb is in line with the radius because the plaster is molded in slight ulnar deviation. The capillary refill should again be assessed after the splint application is completed. A triangular bandage is used to immobilize the arm. The longest side is positioned over the shoulder of the unaffected arm. The other side is positioned over the shoulder of the affected arm. A reef knot is used to fixate the triangular bandage. A safety pin is used to attach the triangular bandage to itself, making sure to support the elbow. This finishes the application of the triangular bandage. Note that the hand is positioned higher than the elbow to prevent swelling of the forearm and hand. Be aware that a triangular bandage is preferred over a sling, as a sling carries the risk of causing pressure complications via indentations in the plaster.